If a 32-year-old smoker presents with an ischemic stroke, most of would be reconciled by the fact that it is an early atherosclerosis. But remember, in patients under 45, the traditional vascular risk factors explain less than half of the strokes. The real causes are often structural or genetic or a hypercoagulable state and are frequently missed. Young stroke typically arises from a non-atherosclerotic mechanism. Three dominant mechanisms we have discussed already. One is an arterial pathology, particularly cervical artery or vertebral artery dissection causing intramural hematoma and luminal narrowing. Next is a cardioembolic source, especially paradoxical embolism through a PFO. Third is a hypercoagulable states, including antiphospholipid antibody syndrome, inherited thrombophilias, and malignancy-related thrombosis. These mechanisms produce embolism without the traditional plaque rupture. So the traditional treatment of antiplatelets might not work in them. Large registries like Helsinki Young Stroke Registry have shown that cervical artery dissection accounts for 25% of young strokes, and PFO is present in 40 to 50% of cryptogenic young strokes. Over this, the landmark RESPECT and the updated RESPECT 2 in 2017 demonstrated that the PFO closure significantly reduces recurrent stroke in people who had PFO and a stroke. So always look for these clues. Neck pain or headache preceding stroke is a major clue for carotid or vertebral artery dissection. These symptoms may be few hours or few days before the stroke. Another underdiagnosed condition is cerebral vein thrombosis, particularly in young women with dehydration, pregnancy, fasting, or OCPL use. So when evaluating a young stroke, always ask one critical question. Was there a preceding trauma to the neck or a manipulation in the neck? It could be yoga neck extensions, chiropractic manipulations, sudden coughing, or a sports injury or a whiplash. And another practical imaging pearl is that CT angiography of head and neck should always be done in young strokes because a plain CT alone misses the diagnosis. So in young stroke, assume nothing. Uncommon causes are often the real diagnosis. Thank you.